Hello and welcome to CNBC-TV18. India has announced an extension of the nationwide lockdown till the 3rd of May as the number of COVID-19 cases cross the 11,000 mark. The Prime Minister has announced that the fight against coronavirus will be more stringent till the 20th of April. The centre has issued guidelines to allow economic activity to resume in a graded manner. Joining us right now is Mr. K VijayRaghavan, Principal Scientific Advisor to the Government and Co-Chair of the COVID-19 R&D Task Force. Sir, thank you very much for joining us. First of all, could you explain to our viewers why was it important to extend the lockdown till the 3rd of May?
Well, it's very important to keep in mind that the principal focus are our vulnerable people, the poorest of the poor, our workers, those who are, older people who have issues with their ongoing illnesses. If these people have to be protected and if economic activity has to simultaneously begin, then we need to ensure that all the work which we have put in over the past few weeks in ramping up our health infrastructure, our defensive infrastructure, all of them are now implementable at every single level. So that last step of how to release to open up economic activity while protecting everyone is being put in place. Our state governments have also asked for this kind of an extension to put this in place. Therefore, it's vital for our economic growth and for release that this extension take place.
Right. Our next question, sir, this is a problem that we'll have to coexist with. We'll have to live with coronavirus till the time there is a cure, there is a vaccine to deal with it. What after the lockdown? Lockdown can curtail the spread of COVID-19, but it cannot be a permanent strategy. What after the 3rd of May? How are we planning to coexist with this virus?
Well, importantly, the aspect about this virus or any other pandemic is that a specific response against it can take time. Secondly, that specific response might have to be done year after year in some cases. And thirdly, the immunity of a population needs to be analyzed and decided upon in terms of the kinds of response we need to take. Given these uncertainties, and these uncertainties, by the way, will go away as we get more science and information on it. But given that situation, it's important to have in parallel other strategies which allow economic opening up. And that is a combination of the traditional contact tracing and testing with a new digital approach which provides you some kind of a digital immunity. Basically, this is a method which says if someone is tested positive or shows symptoms which are likely to make them positive, then all their previous contacts over the past 14 days or so are alerted, and depending on the way they came in contact with them, they're warned appropriately. This allows you not only to isolate those who are positive, who might infect others, but those who were asymptomatic previously and who might infect others. So this is a digital way of the classical contact tracing, which allows us to keep one step ahead of the virus. Right. The digital way is important because it allows us to act with great speed, which otherwise we will not be able to act.
Right. So I'm assuming, sir, you're talking about the Arogya Setu app. And is this now critical to the government's plan of a lockdown exit post 3rd of May?
So the very important thing about Arogya Setu and contact tracing is that it needs to be downloaded and used by a very large number of people so that you can protect the entire community. There are feature phone versions, and community workers will work with those who don't have any phones at all. So a particular area is enveloped by this kind of a digital immunity, allowing an assessment of whether that area, combined with testing and group testing, can go into the economic workforce or not. So that's very important that, it can serve as an e-pass in collaboration with local authorities, and it's important that everyone use it.
Right. Talking about testing, sir, we have seen US conducting over 2.2 million tests. Spain, for that matter, has carried out over 3 lakh tests. France has already carried out 2 lakh tests. But in India, we have seen only about 2.3 lakh tests done so far. Why are we not testing enough? And what exactly is our strategy when it comes to testing? Because globally it is being said that testing is absolutely necessary to curtail the spread of COVID-19.
Testing is very, very important, and the ICMR's and the Health Ministry's testing strategy has focused on the most likely and most vulnerable groups. This is now expanding to cover a large number of groups and large number of states. A very significant number of our national laboratories and research institutions have been opened up for testing. The private sector has been opened up for testing. Now, there are three different aspects of testing we should keep in mind. The gold standard RT-PCR testing is something which tells you whether the virus is there or not. And that is being expanded, as I said, despite the challenges of getting reagents and machines, and that's being addressed really well by the Testing and Diagnostics Committee, which is headed by Mr. C.K. Mishra and others. So that is expanding. So that tells you whether the virus is there in someone or not. But two other very important kinds of tests are happening, which will be of great value. One, there are tests which look at the response of the virus as opposed to the presence of the virus. These are a little delayed because the response takes some time coming. These are called antibody tests. Those were fraught with all sorts of problems. Some of those problems are going away, and their interpretation also has to be done in a sophisticated manner on where you're testing. So that is also being rolled out now, and that will allow group-level testing, which is very effective, though individual interpretations, one has to be very careful on that.
Okay.
Thirdly, there are testing strategies which pool multiple samples and look at it, and those are also being expanded.
Right. But do you feel that there were infrastructure constraints which probably stopped us from testing enough over the last 21 days or so, sir?
I wouldn't say there were infrastructure constraints. There were supply chain constraints of various kinds of reagents and kits, and those are complications because while many of our infrastructure here is local, some of the components had to be imported. But now Indian scientists, Indian industries, startups have come up with many components which are being made here, and those issues have been addressed, I would think.
If we speak about our own research into the coronavirus pandemic, how much are we investing in this to do our own research about the mutations in India?
So overall, the research by our science agencies, their laboratories, our research institutions in our universities, research labs in our universities, and our industry have come together extraordinarily in a variety of areas, including drug discovery, vaccines, as well as diagnostics, as I said. Now, you specifically asked about sequencing viruses. That is now being started on a significant scale by what is called serology, where people will take samples from a large number of blood samples from a large number of people and look at the prevalence of the virus in them, the response, the antibody response, and also look at the prevalence of viruses in samples from nasal swabs, for example. So more and more sequencing data will be available from India over the days.
Okay, and how much pool testing are we planning to do, sir, and when does pool testing begin?
So there are two kinds of pool testing. The ICMR has suggested, particularly in areas where there isn't a significant amount of positive samples coming up, that you can pool 5 samples and test them. And if they're negative, the test is sensitive enough, of course. If they're negative, then all 5 are negative. If one of them is positive, you need to go back and check all 5. So this is a simple way of pooling. But our scientists themselves and also our scientists elsewhere have come up with complex algorithms which allow you to do the minimum number of tests in samples as large as 60 pooled together. Those should be tested out very soon, and they will computationally tell you if there's one sample in 60 which is positive, how do you identify that? You don't have to test all the 60 again, but there are ways of having overlapping pools so you can very rapidly home in on the sample which is positive.
And are we also testing the efficacy of HCQ right now?
HCQ efficacy is part of multiple global trials, and India, as you know, is a large manufacturer of HCQ. And so far, the results as they come in have not, given evidence that HCQ is of value in COVID-19 treatment. HCQ, of course, as you know, is a drug for malaria. It is also used for rheumatoid arthritis and lupus, and its value for malaria remains to be shown. For COVID-19 remains to be shown.
Right, but are there any other alternate vaccines, sir? Then why is HCQ being used right now? Other countries are also talking about it. Are we looking at alternatives?
So there are two, things to look at. One, available drugs and repurposing them. And that, is very valuable to test out. Robust and rigorous tests need to be done. One cannot go, a hypothesis is good, anecdotes are good, but two anecdotes don't make data. And in this kind of a situation where people's lives are important, rapid but high quality trials need to be done, and they're happening. So we'll know about repurposing, whether it works or not. Another drug which is being repurposed, tested for repurposing, is remdesivir. There are, again, global trials for that. That seems to have been a little promising. Let's see how that goes, but we'll know rigorously. The other kinds of drugs are new drugs, and new drugs against viruses in general pose a problem because the virus, in this case particularly, uses substantially our own machinery to replicate. That means a drug which attacks the virus can also attack us. And therefore, a careful choice of a drug which acts early during virus replication before it overwhelms us is important, and it's tough. Vaccines are much more established route, but of course they take longer. But looks like the progress on that is going well, and we should have touchwood, a candidate which is useful in about 9 months' time.
But HCQ has been recommended for COVID-19 patients in India as well, sir. But why is it being done despite the fact the efficacy is unknown so far?
Well, it's in general, when you don't know whether something is useful, you ask another question, whether it can cause harm or not, because in a difficult situation, you want to try something, but even if you don't know that it works. But then the question you ask is, does it cause harm or not? And therefore, because you have to be very careful that it doesn't cause harm, the health ministry, the ICMR, has recommended it's used in context where people who use it can check whether it causes harm or not, i.e. frontline health workers.
Right. Our final question would be our requirement for medical equipment, ventilators, PPEs. We have placed orders with foreign countries as well. Automobile manufacturers, private companies have also been roped in along with PSUs to make this. But do we have standards for ventilators and this medical equipment, which is critically needed right now, sir? And do you think these private companies, which are making efforts to make these ventilators locally, can they actually deliver in a short period of time?
Well, there are three parts to this, and all three parts are very important. First of all, the kinds of components which go into medical equipment, let's take ventilators, are the kinds of components which are used in a variety of other industries. The automobile industry is a good example, controlling airflow in a specific manner, injecting, vapor in a particular manner, and so on and so forth. So the repurposing of automobile industry and other industries to make these kinds of things is eminently feasible. The challenge, the second part is the challenge in this requires component supply chain to be effective. That challenge has been addressed. So therefore, the component supply chain can also be taken care of. The way these two have been addressed is by looking at the standards, the point you raised, and that's the third part. And that part has been run really well. The Bureau of Indian Standards, the Department of Pharma, which looks at standards for medical devices, have come up with a set of very good, reasonable standards in this situation. So for ventilator standards, different kinds of assistive device standards have now been very clearly laid out, and our industry has risen to the occasion and is doing this in a very effective manner.
Right. Mr. Raghavan, thank you very much for joining us and giving us that perspective on how India is fighting back. Very important days ahead, and it's very important for people across the country to pitch in this fight as well, because community transmission has to be stopped at all costs. Thank you very much for joining us. With that, we take a short break here on CNBC TV18. But when we return, we would be joined by Ajay Prakash Sahni, Secretary, Electronics and IT, Government of India, and Lalitesh Katragadda, founder, IndiHood, on the centre's Arogya Setu app and how it is helping us fighting the pandemic. Don't go anywhere. Welcome back. You're watching CNBC TV18. The central government has launched the Arogya Setu app to step up the fight against COVID-19. The government says the app helps in contact tracing, telling you if you've come close to anyone suffering from COVID-19 and keeps you updated about the risks and do's and don'ts. Joining us right now are Mr. Ajay Prakash Sahni, Secretary, Electronics and IT, Government of India, Lalitesh Katragadda, founder, IndiHood, co-founder, Google India. He's also an advisor to the government on the Arogya Setu app. Lalitesh, if I can come to you first, how will this application, the Arogya Setu app, help us in curtailing the spread of COVID-19, especially when this app is based on self-declaration?
Yeah, hi Parikshit. So this app does three things for you. One is the simplest thing you can do as soon as you download the app is take a self-assessment, which uses the Government of India protocol published by ICMR, through which you can know whether you're fine, you need to take further precautions, or you need to get tested. And then the government machinery springs into action to help to make sure that you are tested and taken care of if testing is necessary. And then you don't have to understand the complicated mechanism of how to understand the flow chart and so on. And the second thing it does is if you step outside your house for whatever purpose, it starts recording other Arogya Setu app users who might be near you, how far they are from you, and how much time they spend with you, for one single reason is if any one of them in the future, if they get infected, it will come back and trace you and say that, okay, you were at close to this person for a substantial period of time, you might be at risk, so you might want to get yourself tested, and then either you reach out and get yourself tested, or the health ministry reaches out to you and gets you tested. And the third thing it does is we do measure the GPS location of your phone every 30 minutes. And the reason for that is if, God forbid, you yourself get infected, the government can then use that information and only that information to then go back and figure out what are the hot spots where people might have been infected. So those are the three things it does.
Okay. Mr. Sahni, give us a sense on how effectively can the government use this data that is coming in through the Arogya Setu app, and how many downloads has the application seen so far?
The application has seen 52.2 million, 5.5 crore and 22 lakh downloads so far. And it's been, it's turned out to be one of the fastest, downloaded apps almost across the world. And this is not because of the popularity of the app, I would say, but because of the sheer need that India has to have this app installed on each and every smartphone in the country. Because the more number of smartphone users install the app, the more effective it becomes. It is not sufficient for just you to have the app. It is important even for your family members and for anyone else you come in contact with to have the app installed and running. That makes it far more effective. Coming to the question of data, actually, the data of location as well as Bluetooth, proximity, which is measured through Bluetooth engagement between the two phones, is actually stored on your phone itself. And it's only in the circumstances that you are determined to be at risk, or that it's determined that you are COVID positive and someone else could be at risk because of proximity to you. It is only in those circumstances that the data pertaining to location and various other aspects is then uploaded into the servers, and it's run through very sophisticated algorithms to ensure that we can protect as many people as we can. The important thing in this is that it's the nature of COVID-19. The nature of COVID-19 is that for many days, you might actually be infected. You might be actually carrying the virus and shedding the virus load and sort of, increasing the risk for others, and you may not know it. So for that period, there is no other way to get that advance alert. So that is what this data is used for. It is used to generate advance alerts at the earliest. We should be able to inform people if they are at risk.
Mr. Sani, another question. We also saw reports that the government is considering making this application, the download of this app, compulsory, maybe use it as an e-pass to move around during the lockdown period. Is that being considered, sir?
I won't say the aspect of compulsory. I would say that making it more useful for people. So as of now, it's definitely its primary purpose is to be a conduit to an early alert and to the right advice, authentic advice, connecting you to services pertaining to the pandemic. But as we move forward, and if someone has to move out of the house for some legitimate reasons, there are so many reasons why a person may have to go out, say for grocery shopping or for some inevitable purpose. There would be health functionaries, there would be other frontline workers, sanitation workers, etc., who have to go. In that case, the government is considering, and the tech team that is working on this is considering the possibility of integrating e-pass kind of a system, because this one basically indicates whether you are at risk or whether you are simply not at risk, you are safe, or you are at low risk, or you are at significant risk, or you are, in a sense, COVID positive.
Right.
So in those, depending on those, that also has a very close correlation with how your movement can be permitted, or can be permitted in a manner which is not endangering others' safety.
Right.
So e-pass is a very natural thing to sort of join up with this app.
Okay, so e-pass could be something that the government could launch in the coming days. But Lalitesh, to get you in at this point, currently this application is limited to downloads for smartphones. The government, we believe, was working on making this download available for feature phones as well. How soon can we expect that?
Yeah, so let me be honest. It will not ever be available on all feature phones because technically it's just not possible with the state of the technology of feature phones and the capabilities they have. What we are working on, I can tell you transparently, is making it possible for it to be used on all Geo phones because they have a smartphone-like OS called KaiOS, and there is a team in Mr. Sahani's organization as well as generously Geo itself work together working on building it or making it possible for Geo using the same infrastructure in the backend. And on the e-pass front, I don't know if you noticed, if you open the app today, there is a little icon on the right saying e-pass coming soon. So we are imminently going to integrate that.
But Mr. Sani, if I can come back to you, how will this actually help us in stopping community transmission? We've got several hotspots in the country. The Prime Minister has said that the next 1 week is critical. We will make our fight more stringent. How will this help in curtailing the spread of coronavirus, probably in hotspots like Dharavi?
Yes, basically, since this app focuses on who is at risk and what is the degree of risk he or she himself or herself carries, and what is the risk that they pose to others. So where there are hotspots that have already emerged, that information would also be used to be able to guide people, if they are sort of close to a hotspot. That functionality will be brought in. I think it is not there yet. Probably Lalitesh would be able to add something to that. But that kind of information, as we move forward and as it gets downloaded more and more, I think some of that also will get integrated to improve further the quality of our risk assessment pertaining to a person, risk assessment pertaining to a location.
Let me actually throw an economic angle at this because I think that is being lost in the picture. see, if you really want to keep the country safe, right, there's a very simple solution. Everybody stays at home for the next 9 months until the vaccination comes, right? And that is not possible because the economy will come to a grinding halt and millions will starve.
Right.
Now, if you take a look at India, India has, two ends of the economy that are very, very important. One end of the economy is the farming economy, which is 65% of our people work in it. And if you saw the circular today, the establishment and the Prime Minister have unlocked that. Most of the farming economy, I build products for farmers, so I'm very, very happy to see that they're able to go about their business, right? And that starts getting unlocked because in many ways, our villages and our geographic structure of our farming community is such that it lends itself to natural isolation, right? And there are simple precautions which can be taken on a local basis that will help them, and they are not smartphone users.
Right.
Now, coming to the head of India, there's a very interesting observation about India economically, which is 80% of India's population, 80 million people out of 1.35 billion, 80 million people in India constitute 90% of our disposable income, right? This is the head of the economy. If it comes to a grinding halt, our public services come down, our taxes go down, and we will be in shambles.
Right.
Now, the one way to unlock these 80 million people to work and to be productive and produce most of our economy is to have all of them using Arogya Setu. And if you look at your life, my life, Mr. Sahani's life, we have 3 or 4 other people who are not belonging to these 80 million people we are dependent on, right?
Okay.
It could be our household help, it could be our office boy, and whoever it might be. So if you take 80 million and multiply it by 4, 350 million people, if we can get them onto Arogya Setu app, which is the 80 million people and all the people they come in contact with, your office workers, your factory workers, and so on, that actually creates a containment zone in which people can be safe and work, and that unlocks the economy at the top, and the bottom is already being unlocked. At that point, you can then go on for long enough until the vaccines arrive.
All right. So thank you very much, Lalitesh and Mr. Ajay Prakash Sahni, for joining us and giving us your perspective on the Arogya Setu app. So the government believes that this could be used as an e-pass in the coming days as well. It could help revive economic activity as well in the days to come. Thank you very much, Lalitesh and Ajay Prakash Sahni, for joining us. With that, we come to the end of our show. But keep watching CNBC TV18 for all updates on India's fight against COVID-19.